Okay, here is one of the most important videos in this series. It is about stretching, okay? So we need to make it very simple. The classification of stretches in chiropractic, or at least in chiropractic we run, which shows to be very successful if it is followed correctly. The system is like this. Now, the purpose of the stretches we teach, the basic stretches, which accompany the adjustment you receive, is to restore and improve the natural range of motion of your spine. Okay? Because one of the main causes of degeneration, arthritis in the joints, and pain and stiffness and pinched nerves and all these things is the loss of natural range of motion. You lose the range, the joints are not moving, they start to become stiff, the ligaments and tendons stiffen, the circulation and supply of the joints goes down, it gets less, so the tissues, the cartilage, the ligaments, the tendons, the muscles get stiffer, harder, they get more fragile, they start to break down, so you get degeneration. Okay? So we try to catch this process earlier. We try to restore the flexibility, restore the alignment, restore the circulation, restore the blood supply, nerve supply, the flexibility as much as possible, as soon as possible, and then maintain it. So the symptoms go, the negative symptoms, the bad symptoms, and the normal function restores. Alright? So the first thing we want from you, if you want to get better, is just follow up your natural pattern of motion, which we call a range of motion. So if your neck is designed to turn 90 degrees, it has to be turning 90 degrees as many times a day as possible. If you cannot turn 90 degrees, if you can only turn that much, then do that. Because if you don't do that, you will lose that as well, and you'll only be doing this. So that's the first point. Go as much as you can in the range of motion you can, and as more you do it, as further you will be able to go. Just one example. And on that example, you can work with other things, with lateral flexion of the neck, with pulling your neck down, you know. This is the first stretching idea we give to patients, and it is very simple. Go through natural motion as much as you can. Do not cause pain as you do it. Do it as often as you can. Do it small. You don't have to do it for half an hour, for 10 minutes, for 15 minutes. You don't have to do it 100 times. I say that because people do that. Don't do that. Just do a couple of times. Just check what station it is if you're on the train. What is the station, right? Or see who's behind you, you know? You may see someone you like or someone you know and say hello, right? So follow natural pattern of motion. Do it often, do it small. We say 5 to 10 times, and do it 5 to 10 times a day. So do it in the morning, do it lunchtime, do it late lunch, do it early dinner, do it late dinner, do it night. That's it. If you can do it more, even more than I said, you improve quicker. And because it's a natural motion, you will not get worse. It's impossible to get worse doing these things. So that's the first level of stretching. Same for your shoulders, same for your mid back, upper back, same for your low back. Generally, you get all the stretches after your first adjustment at the clinic. If you if you wait, we will post them here on your app, on this app you downloaded. And that will also be available on YouTube and Facebook. We have nothing to hide, and we are not charging for these exercises. They are free. So that's another thing. You ask patients, look, how's your stretching? Oh, I didn't have time, you know? they have time, they just forget to do it. So use your smartwatch, use your telephone, use your computer, use your wife, use your husband, use your friends to remind yourself about these things. All right? Simple range of motion. So instead of sitting like this all day in front of the computer, just do that every half an hour, you know, a few times. And you notice you start with this today and you finish with that a week later. Amazing. So you need less adjustments with us, or none, if you choose not to be a chiropractic patient and do it yourself. Fine. We did our job, we gave you advice, you follow up, you feel good, that's all that matters, you feel good. Small and often, don't cause yourself any pain, okay, and you get better. Now the next level of adjustment, next level of stretching is the specific stretches for specific muscles. It's what physiotherapists give you, it is what we give you if we find that certain muscle has plays a role in your particular symptom, like a piriformis muscle in your gluteal area, in your buttock area, gives you leg pain, for example, because it's pinching on the nerve. We give you this particular stretch for piriformis. You do the piriformis. That's the next level. So the first level is simple little things you do every day. That's very important, small and often. The other level, next level, is a specific specific stretch for specific muscle. Okay, that comes later. That comes after the specific assessment of this alignment, muscles, etc. And that's the next level. Okay. It's very important not to overdo the stretching, because if you do too much stretching on your neck, for example, or your back, you can make it weaker. You can make it over flexible. You can also damage the muscles through overstretching. So it has to be geared and measured very well. So always ask your chiropractor, what shall I do? How much shall I do? When shall I do? If you find these stretches on the internet, most of them are good, right? But you have to do them correctly, at the correct time and amount. So ask us about certain stretch. Is it good? Is it not good? Because there are different stretches for different needs, and there's no person the same as the other person. I often say that most problems we see in a clinic are very similar. Neck causing the arm pain, back causing the leg pain, middle back causing the chest pain, right? Very similar. But every patient is different. So only observing a certain patient with a certain problem, we can give a correct advice. Remember that. But start with basics. If you don't do basics, that's another point I often make. If you don't do the little basics, a general range of motion of your neck, shoulders, back, shoulders, arms, mid-back, which takes no time. It takes very little time, honestly. But if you don't do these basics, please don't start telling me about some, I don't want to do the names here, but some special system you found on it, which is amazing. See, do the basics first. If you've done the basics, you may not need the special system. If you've done the basics and you do the special system after, you have amazing results, you know? But start with easy things, and easy things are always the best things, as you know. Alright? I see you in the next video in the series designed for our app. Remember to download the app.